Health Month, and today we're getting life-saving tips and simple ways to show your heart a little love. Get it? Get it?
I get it.
Get it? All right. From cardiologist and ABC News chief medical correspondent, Dr. Tara Narula. Welcome, Dr.
Welcome to the show.
Okay. All right. So tell us about the importance of heart health. What do we need to know? Especially women, you know, women tend to ignore all signs of trouble.
Right. So it's so important to understand that this is the leading cause of death for both men and women in this country. About 1 in 30 Americans dies of cardiovascular disease every minute, and it kills more of us than all forms of cancer combined. And as you said, Kelly, in particular, women, 40% of women don't realize that it's her biggest health threat. And yet the majority of us are walking around with some sort of risk factor, almost 50% with high blood pressure, 40% with obesity, 60% with pre-diabetes or diabetes. So we would love for this to be on everyone's radar, not just in February, but every month. And to think about it, just like we think of getting our mammograms and our pap smears and our colonoscopies, people should be getting screened for heart disease.
People are so afraid of cancer, and they never are afraid of heart disease.
And we want them to be afraid.
And a good place to start is to know your family history, right?
Absolutely. So there's so many things you can do. Definitely family history is one of them. Sometimes I see people where the only risk factor they have is a family history of early cardiovascular disease. But really knowing your numbers, so blood pressure, cholesterol, blood sugar, body mass index is important. There are risk calculators that doctors can use. You can actually go online and look it up. There's one called Prevent, where we plug in your age, gender, and some of your risk factors, and we can tell you, you have a 10% chance of having a heart attack or stroke in the next 10 years. And then one of the tests I like that we talk about a lot are calcium scores.
Yeah, what's a calcium score?
This is so great. I wish everyone would get one.
I don't have a calcium score.
I do.
You should get one. It's about $100. They're usually not covered by insurance, but really it's a very quick CAT scan, no contrast dye, very low radiation like a chest x-ray, and it's a peek under the hood, I like to say. So you're basically looking for spots of plaque in the heart arteries, and you get a score. So if your score is 0, you're in a low risk group. Anything 0 to 10 is generally low, but over 100 is considered high risk. So really great test.
And what age should you start to think about that?
Typically we think about it over 40, but I actually send some people who are even younger if they have, for example, a family history or risk factors.
Oh my God.
LPA?
LPA. So a lot of people don't know what that is. This is a newer type of blood test for a bad genetically inherited cholesterol. In fact, 1 in 5 worldwide have an elevated LPA. And basically this confers an elevated risk of heart attack and stroke and aortic valve disease. And so if you test high for LPA, you also want to have your family members screened. So kids, siblings.
Do you have an LPA?
I don't know. I'm going to find out.
I know.
At commercial break.
LPA,
there's so many tests we need.
Yeah, we're going to take a break. We're going to know when it's time to head to the ER. That's very important when we return. We're back with cardiologist and ABC News chief medical correspondent, Dr. Tara Narula, discussing heart health. All right. When do we know when it's time to head to the ER or if we're overreacting?
Yeah, so usually if the chest pain is severe, if it's persistent, if it lasts for like 10, 15, 20 minutes, you want to think about going to the emergency room. If you feel anything else with it, like shortness of breath, nausea, fatigue, but really I tell my patients, because I get these calls a lot, when should I go? You really should just err on the side of being cautious, because in the ER they can do a blood test where we can tell you if you are having a heart attack. They can do an EKG or an electrocardiogram and really better assess you, because once those heart cells die, they're gone. Right? So you don't want to take any chances.
What about those other symptoms like the arm pain, say like a pain in your jaw? Yeah.
Right. So a lot of people think about just chest pain, and that is by far and away the most common symptom for men and women. Although I will say sometimes when we say pain, people don't understand. It's really much more of like a pressure, tight squeezing. A lot of women have told me, I just want to take my bra off. I feel like it's on too tight. But also shortness of breath, jaw pain, shoulder pain or back pain, even upper abdominal pain, nausea, feeling dizzy or lightheaded, and sometimes just fatigue. So many women will say, I'm just exhausted and I don't know why.
And those signs are different? Those are specific to women, those signs?
So both sexes can have it, but women can have some of those less often talked about ones, like the nausea, indigestion, flu-like symptoms, fatigue, shortness of breath. They don't have to have the chest pain.
All right, so what are some of the key things we can do to lower our cardiovascular risk?
So 80% of cardiovascular disease is preventable by what we can do. So for example, eating a heart-healthy diet, so more plant-based diets, Mediterranean diets, exercising, we say moderate cardio, at least 150 minutes a week of that. Making sure you know your numbers like we talked about, getting enough sleep, 7 to 9 hours, managing stress and mental health. These are all the things we have in our control.
What if you don't get enough sleep? Will that be
So, you know, the American Heart Association used to have something called Life Simple 7. These were the 7 things you can do. And a few years ago, they added an 8th. Guess what the 8th was?
Sleep. Right.
So it really is so important to our health that a lot of us just let it go. But that 7 to 9 hours is really key for heart health.
Okay. Well, we're going to work on that.
Yeah.
We're going to get our, what is the score called?
Calcium
score. Thank you, Dr. Narula. For more information, go to our website, and we'll be right back.